you understood the importance of psychology and psychiatry in your field, about the real definition of your major as physiotherapist, in close connection to psychology and psychiatry in your field, we mentioned. And this is some review of them. Then we will enter to different psychological and psychiatric disorders. Let's have a review at first step, and then you understand that what's the benefit of knowing about the different definitions of psychology and psychiatry. About autism, I will review autism at the end of this discussion again. But now I want to compare your concept about psychology at this step, and after definition about different terminologies of psychiatry and psychology, and then you will understand what's the benefit of knowing the definition of terminology. So, ASD, autism spectrum disorder. Have you ever heard about autism? Yeah. Have you ever seen any autistic patient? What do you think what is the main signs, symptoms which you see in autistic patient? For example, what's the main symptom or sign or presentation you have seen in autistic patient, for example? Social interaction. The most important part of autistic patient is problem in social interaction. Can you explain more in which aspects of social interaction they have problem you have seen?
Yes, they have problem in verbal actions and
You mean in language?
yes,
Okay. What else?
they prefer to stay alone.
Prefer to stay alone. Very good, very good. What else? Anything? Anybody wants to add more signs, symptoms of autistic patient?
Don't have attention.
Problem in paying attention. Don't pay attention to anything. Yes.
Don't anyone to touch him.
Okay. Don't let anybody to touch him. He's irritable, impulsive. Very good. Very good. Yes, anytime you want to make connection, you want to make communication with autistic patient, they refuse. And even you cannot touch him, you want to touch him, he starts some challenges and shouting, crying. Very good, very good. It shows that you have seen autistic patient. What else?
Eye contact.
Problem in eye contact, one of the main problems. That sometimes I say that any person who makes eye contact, he doesn't have autism. One of the main key symptoms or presentations of autism is problem in eye contact. So, see here, this is the diagnostic criteria of autistic patient. It means, what is diagnostic criteria? Means that these are some criteria you should have during taking history, physical examination. You find and you diagnose that, for example, this patient has autism. And this diagnostic criteria is very important for you. For example, you should have all these processes during taking history and clinical examination. You can diagnose the patient as having autism. So, look at here, just as, a practice, that how help you knowing about different titles, different terminologies in psychiatry and psychology, how it helps you. Social communication and social interaction. See, problem in communication. Which problems? For example, social reciprocity. See, in 3 domains, you should have problem. You say that you have problem in social interaction. Which symptoms? During taking history, during physical examination. See, social reciprocity is the other name of social interaction. Means that going in the, for example, society and making bi-directional communication. We call it social reciprocity, social interaction. I told you the definition of communication. Whenever you mean that social communication or social interaction, you have 4 domains. First, some message you send. This message can be an idea, opinion, needs, grievance, complaints, feeling, emotion. Anything you send to idea, your thoughts, your information, anything, a message which is sent by sender, received by receiver through a channel. This is communication, 4 domains. A message is sent from sender to receiver through a channel. We call it communication. So, social reciprocity means, bidirectional sending, receiving messages. This is social reciprocity. What is the next part of problem in social communication or social interaction? Is non-verbal communication. Non-verbal communication, I told you that based on the type of message, we have 2 types of communication. Verbal, which you use words for communication. Non-verbal, you use no words during communication. And the main problem in non-verbal communication in autistic patient is eye contact. They don't have enough eye contact during communication. And the next, about social communication, is developing, maintaining, understanding relationships. What is the difference between relationships and communication? What is difference? We say that in 3 aspects we have problem in social communication. First, social reciprocity. You want to buy something, go to a market, talk to the, for example, seller, ask something, buy something, come out, goodbye. This is a social reciprocity. Now we are in a social reciprocity. I teach you, you learn, ask question, answer, social reciprocity. Non-verbal communication means my body posture, understanding the body posture also is defective in autistic patient, understanding the eye contact, and also making eye contact, making proper, appropriate body posture has problem in autistic patient. But the other things is problem in making relationships. What is the definition of relationship? What is the difference between relationship and communication? Who knows?
Relationships, it is the engagement and interaction with people.
So again, communication, social reciprocity. The same definition. So what is difference between social interaction and social communication with relationships?
Relationship is contracting with anyone I know in person. But communication, I can communicate with anyone.
Okay, you said the same. You are right. Communication with anyone. You said a relationship again with anyone.
I don't have any relationship with anyone.
You have to somewhat, okay. See, making relationships like making friends. Be friendship, see? Continuous and goal-directed social interreciprocity. For example, when you make relationship with somebody, it means that you are friends. So it means that they cannot develop, friendship communication with the others. They cannot understand friendship, being friend, having friends. So as you mentioned, who said that they all the time likes to be alone? Who said about the symptom, sign of autism, said that they like to be alone? Who mentioned? You. That they like to be alone. Because of that, because they don't have any friend. Developing, maintaining, understanding. See, very important that communication is a general word. Relationship is a type of communication which continues. And what is the message, the important message in relationships? Emotional messages, feeling. During relationships, you transfer your feeling, you transfer your emotion. But in general communication, social reciprocity, it's not necessary you transfer your feeling, your emotion. So, continuous communication with somebody, a targeted communication, which you also transfer your emotion and your feelings, relationships. So, one part problem of autistic patient is social communication. But the next, restricted repetitive behavior and interest. You should understand the meaning of behavior and interest completely. I will explain about what is behavior and what is interest. So, you should have two of these four to understand, to diagnose that you have restricted repetitive behavior and interest. First, stereotyped and repetitive behaviors, like do this, like do this. See, a stereotype repetitive behavior. Insistent unsameness. All the time he is busy with one, for example, toy, one thing, anything. Which means that persistence on the sameness. Okay, you have some toys here, but he doesn't pay attention to none of them, just are busy in one thing, and he will be locked on that. Insistence on sameness. Highly restricted fixed interest. He just likes to play with something, not with different toys and something like that. So, insistence on sameness, you can see by your observation in the office. But highly restricted fixed interest is based on the history. You ask from the parents and you understand that what is his, for example, hobby. He says that all the time his hobby is very restricted, something. All the time is busy with painting, with drawing, something like that. And hypersensitivity or hypersensitivity to sensory inputs. Also, the meaning of this is now is just translation of the sentence means that he pay attention to something and do not pay attention to the other things. Be locked to some stimuli. I will explain for you this part today for you, and you will understand what's the meaning of behavior, what's the meaning of interest, what's the meaning of sensory inputs. So when you know the meaning of these, you will understand this criteria. And for autism, I will review for you, and we will emphasize in autism a lot, at least one session more, after understanding the meaning of each of these sentences. This is just as a practice, that what is the importance of knowing the meaning of interest, knowing the meaning of behavior and communication. And here also we will point out to this part that early development of the signs and symptoms during the first 2 years of life, if these symptoms is started late, for example, you say that how long does it take that he has these symptoms? He said that from 5 to 6 years old. Maybe some trigger factors, anxiety problems, depression is responsible for these problems. In next semester, when you have child and adolescent psychiatry and psychology, I will explain for you that depression in childhood, anxiety in childhood can show the same symptoms. But how you can differentiate between autism and depression and anxiety? This is that the symptoms should be present in early development. But in other children said that, okay, after entering to school, these symptoms started. So it cannot be neurodevelopmental disorder. And again, I will explain for you what is neurodevelopmental disorder. Now, I'm just giving you some words that maybe is difficult for you or complicated for you understanding the meaning. And also, the symptom must cause clinically significant impairment in current functioning. Do you remember what's the meaning of disorder? I told you. See, ASD is autistic spectrum disorder. What's the meaning of disorder? Problem in your function, in your performance. In which aspects? Daily living activity, social activity, academic activity, professional activity. For sure, a child doesn't have any profession, but in other aspects, daily living activity, academic activity at school, and social activity, when you have problem in this function, it means what? Impairment in function. It means disorder. Do you remember the meaning of disorder? Impairment in normal functioning. The complication, the effect of a problem in your action, in your performance. We call it disorder. So when you say autistic spectrum disorder, it should have caused significantly impairment in current function. And not better explained by intellectual disability or developmental delay, I will explain for you in future. So, I don't expect you to memorize diagnostic criteria of autism at this level. I will teach you autism in future. But you see some terminologies here, which now you should learn just disorder. You understood what is disorder. Any impairment in normal function, any impairment in performance, in which aspects? Academic, professional, social, and personal activities. Okay. But we have some terminologies here. You understood somewhat the meaning of communication and relationships, yes? Also, I will explain it more in future. But here, you have some words which we should talk about them more. Because the main presentation of autism is in communication and behavior. You see in the behavior, in the action of the patient, what? Restricted repetitive behavior, restricted interest, insistence on sameness, restricted interest, hypersensitivity to sensory inputs, hypersensitivity to sensory inputs. What's the meaning of these parts? I want to talk about this more. See, this is again autism, a spectrum disorder, the main symptoms, the main presentations. Impairment in social interaction, especially non-verbal communication. What else? Repetitive, restricted behavior. See, the main symptoms you see in a patient, you diagnose autism. Repetitive, restricted behavior. Do you know what does it mean? Some repetitive behavior all the time do it. Repetitive behavior, all the time do that.
They like routines. They like routines.
Yes, yes. As habits. Some repetitive behaviors. Highly restricted interest. You ask from the parents, what is his hobby? All the time is busy with something. Very restricted. And when he is or she is in the office, all the time is locked to something. And highly restricted sensory behaviors. I will tell you what does it mean, sensory behavior. behaviors in response to senses. What he see, what he hear, what he touch. Highly restricted. You show him a lot of things, but he answers just to some of them or one of them, and do not answer to the other, do not respond to the others. But you should know completely the meaning of these parts. And as I told you, it's very important to detect these types of disorder at early stages of life, because with starting interventions for treatment of these patients, the prognosis, the response of treatment will increase. So it's important to diagnose the patient with these problems at early stages of life. Okay, we want to talk about these parts. This is, I told you, psychology and psychiatry is a part of nervous system function. Which part? At first step. For keeping the homeostasis of the body, I talked about what's the meaning of health and homeostasis. Nervous system has 5 main functions in keeping the homeostasis of the body. First, keeping the consciousness and awareness about the environment. For what? For collection of information through sensation, including vision, hearing, tasting, olfaction, touching. For what? Collection of information. For what? Information processing, which we call it cognition. And psych, including feeling, including emotions, are a part of this information processing. And I told you, information processing starts from attention, and then recording the memories, memory and learning, and then communication, language, and then decision making and action. This is information processing. So the output of information processing is action. This action, they call it behavior. And one type of action is movement, changing the position of your body, of some things, of your limbs. And the last is regulation. It's very important you know the regulation of the other system's function is by nervous system. So whenever you have any problem in psych, in cognition, the regulatory system will be defective. So the regulation of function of digestive system, cardiovascular system, and other system will be defective. You have problem in these parts. So depression, you will have problem in digestive system. Anxiety, you will have problem in cardiovascular system. Immune system. A person who is depressed is prone to infection, to flu. All the time during autumn and fall, he has, for example, flu. He has common. He is ill, he is sick. Why? What's the relationship between anxiety and flu and common cold and sickness? Because the regulation of immune system is by nervous system. When you have problem in nervous system, depression and anxiety is a problem of nervous system. In cognition, you will see which part. The immune system will be defective. The digestive system do not work properly. The cardiovascular system do not work properly. Main functions of nervous system. And this is again, I will repeat this slide a lot, because the goal of your job, of your field, of your major is improvement of quality of life. And what is quality of life? Subjective well-being, normal function. And I want to say that normal functioning is the result of subjective well-being. If you have a depressed patient, if you have anxious patient, you cannot improve the performance. So without paying attention to psychology of the patient and mental status of the patient, you cannot improve the performance of the patient. This is one of the gaps in physiotherapy procedures, that you do a lot of procedures for a patient with weakness in the limb and you see no improvement in the function because you didn't pay attention to the psyche of the patient. So without subjective well-being, you cannot reach to improvement of the performance of the limbs. It's very important. Okay. Now we reach to this important part to understand what is behavior. Remember, psychology and psychiatry is a part of cognition. Psychological diseases or disorders is a type of cognitive dysfunction. And the output of cognition is behavior. So, any psychological problem and psychiatric problems leads to behavioral disorders and problems. How you can diagnose depression, how you can diagnose anxiety, how you can diagnose obsession, how you can diagnose personality disorder, because of its effects on the behavior. And one part of behavior is performance. Anytime you have behavioral problems, it means that you will have problem in your performance in different stages and levels. So it's very important that psychiatry and psychology is the same as quality of life. Because subjective well-being means normal psyche. And normal performance means normal behavior, and it's the result of normal psyche. So, the main aspect of quality of life is normal psyche. What is your job? Improvement of quality of life. What is your job? Improvement of psychological status of the patient. So it's very important in your field, knowing about what is psychology, what is psychiatry. All your results and response to your treatment is measured by psyche. Any performance is the output of normal psyche. And also subjective well-being means normal status of mental status. Okay, what is behavior? Who can give me some scientific definition of behavior? What is behavior? And then after completion of this part, we will come back to different signs and symptoms of autism, and then you will understand what's the meaning of that diagnostic criteria. What is the definition of behavior in psychology, in psychiatry? One volunteer, please. Who can explain for me? Try to speak. Even if it's wrong, you should try to express yourself. It's very important, making good communication. Who can explain for me the definition of behavior?
It is the expected reaction from the individual person.
Expected. No. Expecting action.
Expected action.
No expectancy. The definition of behavior. What expecting? This expecting is a subjective. That you expect some reaction. In social cognition, you will see that expecting that what is your reaction in this position is one of the cognitive aspects. We call it social cognition. For example, something happens, I expect any person based on their personality do this action. This is my social cognition. What happens in me? What behavior and action happens in everybody? So not expectation. You are telling us the definition of social cognition. That now something happens, for example, I'm now doctor and I know what will be his reaction in my expected. So, it's not the definition of behavior.
So you used to do.
Something you,
Used to do every day.
again, what you used to do. What something you do. You act. Behavior is action, not expectancy, not used to. Behavior is action. So, action to what?
Situation
Mm-hmm. Very good.
which can be reserved and reserved.
Hmm? Something you.
Which can be reserved or measurement.
Exactly. What you can see, you can observe, you can measure, you can touch. For what? Okay, better definition. See, definition is different from meaning. You should know the definition of some terms, some words in psychology and psychiatry very good. Because I told you, what is your major improvement of performance and behavior? So what is behavior and that you want to improve that?
It is cute stimuli, maybe can be internal or external stimuli. Internal as the interest, feelings, emotions, and external the environment outside that makes the stimuli that makes movement inside us and
Motivation makes
yes,
motivation.
motivation. And then it makes our behavior.
Very, very, very. Almost you mentioned to some important parts of behavior. Again, I give you some examples. Any abnormal behavior like addiction, if you want to have some intervention, you should know the meaning of behavior and the process happens. Any behavioral abnormalities, right, like aggression, like antisocial behaviors, how you want to have intervention for improvement that those personality or behavioral patterns. Don't think that these are not from your job. Your job is just for example, articular problems, neurological problems, orthopedic problems, some physical problems. No. Physiotherapy means any correction or an occupational therapy, any correction, rehabilitation in conclusion, any improvement in your function, any physiological deviation from normal function. This is rehabilitation in conclusion. Speech therapy, occupational therapy, physiotherapy, any deviation from normal function. So, improvement of behavior is your job at first step, before giving any medication. So, how you want to have any intervention, you should know what happens that any abnormal behavior happens and how you can correct these abnormalities. At first step, you should know how behavior forms. Behavior is any action for what? For reaching a goal. We call it goal-directed behavior in response to stimuli. This is, what is a stimuli? See, in autism, hypersensitivity to sensory inputs. What is sensory inputs? Sensory stimuli. What you see, what you hear. See, in response to those stimuli, you act, you respond. Behavior. When you say restricted behavior, means you do not respond to a lot of stimuli which are in your environment. You don't respond to them. We call it hypersensitivity to sensory input. We call it restricted behaviors. You don't respond to sensory stimuli.
Because of this, autistic people, they are sensitive to noise, resist them to do crimes and be aggressive.
Exactly, exactly. Because they do not, they are resistance to stimuli. But one other reason is at the same time they are very irritable. They are very anxious. These are some comorbid problems. But one problem is exactly like that. Because they want to be locked to some stimulus and they do not want to, for example, separate from that stimulus. So anything distract them from that stimulus, it makes them very anxious and irritable and they try to resist from the change. Anything wants to change the situation, they will resist. Any new stimulus irritates them. So, let's continue. Behavior is an action in response to a stimulus and follows a goal. Three main aspects: a stimulus, goal, action, and you reach to that goal. But see what happens in the mind, what happens in the brain. During psychology, I told you, the main focus of psychology is in the behavior because you can see, you can observe, you can measure. Even anybody who is depressed, till the time this depression has not affected the behavior, will not follow treatment. Most of the people, most of the population, and we call it disorder, that affect your performance. So what is performance? See again here, any behavior you see, any action you see, starts from a stimuli. And as you mentioned, we have two types of stimuli. Internal stimuli, external stimuli. External stimuli are senses. Vision, hearing, smelling, tasting, and touching. You collect information, and these information acts as a stimuli for action. Okay. What is internal stimuli?
Physical needs.
Like, we have two types of internal stimuli. One, physiological needs, like hunger, thirst, thermoregulation, sleep. These are physiological needs which induce you or triggers you to some action. The other internal stimuli, we call it psychological stimuli, like interest. Very good. So, in conclusion, we have three types of stimuli. Physiologically based stimuli, psychologically based stimuli, we call it interest, and external stimuli, which are received through senses. Let's come back to autism criteria. Here. Highly restricted fixed interest. Interest is what? Internal stimuli. So when you have restricted interest, what's the result?
Behavior.
Restricted behavior. So exactly, one of the reasons of repetitive restricted behavior is because of highly restricted interest. Interest, internal stimuli. When you have restricted internal stimuli, it leads to restricted behavior. So now you can understand the meaning of insistence on sameness. Again, it's because of restricted interest. Because behavior in response to your interest will be restricted. See, when you know the meaning of each terminology, it helps you in this way. So, okay, a stimuli from the environment, from your internal interest, from your physiologic needs. Okay, activates which part of brain? The engine of your behavior. Engine, we call it in Arabic, in Iraqi, محرك. And a stimulator, you call it محافظ. So, a stimulator starts the engine, turn on the engine. What is the start? Those stimulators. What is the engine? Your emotion, your motivation. For what? Energize your decision making. You decide, you choose a goal. And then you plan for that goal and then action. This is the process of behavior. So, anytime you want to have some intervention for correction or improvement, the pattern of behavior, you should follow this process. For example, you have intervention at this level, you change the interest of somebody. Is it possible? Step by step, you will see. You change the networks of your emotion and motivation. You know that emotion is very strong, is the engine, is the locomotive of, for example, the train of behavior. Without this engine, you do not act, you do not respond to a stimuli. Like what happens in depression. So again, in depression, you will have restricted interest. It's better to say you will have restricted behavior. But in autism, restricted interest. But in depression, because of weak engine. Maybe you are interested in something, but you are not emotional, or you do not have energy to do the action. Even maybe you decide to do something, but you don't have energy or enough motivation, because emotion and motivation is the engine. In autism, you have restricted starter. But in depression, you have weak engine and you don't act. See, these are difference of understanding the terminology of the words. You can touch the psychology and psychiatry and even help you to differentiate between depression and autism. I told you, step by step, I explained for you, we have exactly the same symptoms in depression of, for example, problems in communication, restricted behavior, restricted interest, but by different ways. In autism, restricted behavior is the result of restricted interest. But in depression, restricted behavior is because of weak emotion. Your engine has problem. But in autism, the starter is very restricted. If he decides to do, but his interest, internal stimuli is very weak. And also, when you have restricted eye contact, so you will have restricted external stimuli also. See, in this way you can translate to psychology. What is the role of eye contact? Receiving some information. When you don't make eye contact, enough eye contact to the environment, You will have restricted external stimuli, again restricted behavior. So this is very important slide, because behavior is the main output, what you can see, what you can measure. And okay, some autistic patient is referred to you, you want to do some action for them. How you can monitor the response of your treatment? Improvement in the behavior, improvement in the performance. So you should have intervention in this way, exactly. Okay. Different types of stimuli. External stimuli, the other name is sensory inputs. External stimuli, the other name is sensory inputs. See here. Hypersensitivity to sensory inputs because of lack of eye contact. They do not look around themselves a lot. Not just eye contact with the eyes, also the rotation of eyes all over the environment is decreased in autistic patients. So hypersensitive to sensory inputs, but hypersensitivity to some sensory input. They are locked to something. I will tell you in future that anytime you want to have some intervention for autistic patients, the room of treatment should have very, very little sensory inputs, because you need paying attention to you. We have sensory rooms for sensory enhancement, a lot of senses. But during intervention, during your procedure, the room should be very simple. No toy, no doll, no color, no noise. Because if you have a toy here, if they lock on that, you cannot shift the attention of the patient to yourself. So these are some rules you should know in neurophysiology and psychiatry, psychology, because they are hypersensitive to sensory inputs and hypersensitive to some restricted inputs. If he is locked to a toy, he never shifts his attention to you. So if you have a patient with autism, you are working in an office full of dolls and full of colors, full of lights, no benefit. The room of autistic patients should has very, very little, no color, no toy, no doll, just a chair, just the doctor, just the patient, nothing else. But you said that we have some sensory rooms for autistic patients, because the way you want to enter, see, these are very important translation. What do you want to do? Changing the action, changing the performance. The way you want to act in the action side is from sensory stimuli. So you should increase the sensation, enhance the sensation. They have problem in eye contact. You should correct the eye contact. You should have vision enhancement. You send them to sensory room, full of colors, full of lights, full of toys, very beautiful. But after that, when you yourself want to work with him in face-to-face, no toy, no color, no doll, nothing. Just you and him. Even the wall should has no color, because if you pay attention to that color, never you can shift this. Okay. So the other name of external stimuli is what? Sensory inputs. Sensory inputs. Okay. Two types of internal stimuli. First, physiologically based motives. Hunger, thirst, thermoregulation, sleep, sex. These are physiologically based motives. But not physiologically based motives, we call it psychologically based motives. And the most important type of non-physiologically based motives is what? Interest. And restricted interest leads to restricted behavior. Restricted sensory input because of defect in eye contact, restricted behavior. These are a stimuli. But we told that, okay, a stimuli is or are a starter. A starter of what? Of the engine. What is the engine? Emotion, motivation, a part of brain. This is very important here. This is limbic system, the center of motivation, the center of emotion, the energizer of behavior. When we say that we have an engine, this engine is amygdala, emotion. How? See, this limbic system is a part of brain that is activated by what? Some stimulus. Consists of thalamus, hippocamp, amygdala, and hypothalamus. These are four main parts of limbic system. And the engine of behavior, we call it emotion or motivation, is amygdala. But how amygdala is turned on? When amygdala is turned on, you are emotional. It's very a strong feeling, emotion, that you decide to do something. It's very powerful part of brain, very powerful engine, a strong engine that motivates you for action. What happens during external stimuli and internal stimuli? How they activate amygdala? Physiologically need motives activate what? What part of brain? What part of limbic system? When you are hungry, which part of nervous system is activated? When you feel cold, that the air is cold and you are, shaking, chilling. Hypothalamus. Hypothalamus is responsible for physiologic needs, motives, activated. And then activate what? Amygdala. And you decide to do something in response to physiologic needs. External stimuli activates what part? Sensory inputs. No. Thalamus. Sensory inputs activate thalamus. You know that all senses except olfactory that directly activate amygdala. It's very important that olfactory directly activate amygdala. Smells, very important. That smells directly activate your emotions. But other senses activate thalamus. You know that when you see something from optic nerve, when you see, occiput center is activated and you see. I can see you is because of activation of occiput. But before, in this pathway, activation of occiput, they send signals to thalamus, and thalamus activate amygdala. This is for your protection. You know, limbic system is activated before you see. This is neurophysiology, you can see. Don't think that thalamus is just for amplifying the relays to cortex, for better signaling. No, thalamus is activated, and before activation of cortex, this limbic system can activate amygdala, makes you emotion. Especially in some reflexive and fast response to the situation. Before you understand what you have seen, you start escape, or you will be in protective position. Hearing system. Before, from superior colliculus, before going to temporal lobe for perception, it goes to thalamus. And thalamus sends signals to amygdala. So, sensory inputs go to what? Thalamus. And thalamus activate amygdala, and it makes you motivated. When amygdala is activated, you feel a strong happiness, a strong fear, a strong anger, very strong. That motivates you to act, to decide. What is the last stimuli? We talked about sensory inputs and also hypothalamus physiologically need. What's remained? Which stimuli is remained? Physiologic needs, sensory inputs, and psychological, what we call it? Interest. What is the site of interest? In which part interest exists and activates amygdala? Hippocampus. What is interest? How interest forms? It's very important in psychology and psychiatry. What is the main role of hippocampus? Who knows? Hippocampus is important part of memory formation, recording the information in hippocampus. Memory formation happens in hippocampus, and you know interest is nothing except your memories of past history, of past memories. It's very important. Don't think that interest forms mostly genetically based. For example, in family, everybody likes mathematics because mathematics has very positive energy in that environment, and interest is your past memories. Good memories of something makes your interest. Bad memories of something makes your hates. So when you are interested to do something, it's because of some good memory of past actions. Exactly, addiction happens from this side. You use some drugs, you will enjoy, and this enjoy is recorded in your hippocampus and forms interest. And this interest again activates amygdala for repetition of that drug abuse. And you will be addicted to that drug. So, any action you do, it will have some effect on you. If it has positive effect on you, we call it reward. Any enjoyable feeling of some action, we call it reward. And this reward is recorded in hypothalamus as your interest. You know, whenever you want to change the pattern of behavior in animals, you give them some rewards. When they act, they receive rewards, and good memory of that reward is recorded in the hippocampus. Acts as a motive which activates amygdala and he will repeat that action. So, hypothalamus physiologic needs, thalamus sensory inputs, hypothalamus interest. These are the starter, the stimulator, which stimulate amygdala. After activation amygdala, something happens. I will explain for you next session. It's enough for you, I think. You are tired. So, after activation of amygdala, what will happen in next steps, I will explain for you.